Dental caries disease, also called tooth decay, refers to demineralization or weakening of the teeth. And the end result of caries disease is a caries lesion. An advanced caries lesion can progress to the point where the tooth surface forms a cavitation, or a hole, which is the physical evidence of tooth breakdown.
When we come to stay. Black attack, we can ruin your whole day. We attack the teeth, we attack the gums, and believe us, that's not any fun. We coat your teeth and chip away, creating terrible
The dental caries, there's a tug-of-war between the pathogenic factors that promote demineralization of the tooth and protective factors that promote remineralization of the tooth. Normally, there's a layer called the pellicle that covers the tooth, and bacteria in the mouth, like Viridans group Streptococcus, settle on that pellicle layer. These bacteria are called early colonizers, and they attach to the surfaces using bacterial surface proteins called adhesins. Because they're on the pellicle of the teeth, these bacteria come into contact with sucrose, which is a sugar found in various foods and drinks, including table sugar. Sucrose has a glucose molecule bound to a fructose molecule. So the bacteria use an enzyme called glucosyltransferase to cut the bond between them, and use the fructose for energy and add glucose to a growing chain of glucose molecules called the glucan. Glucans allow the bacteria to attach firmly to the surface of the tooth and form dental plaque, which is a sticky collection of bacteria, proteins from saliva, and dead cells from the lining of the mouth. Individual bacteria multiply and form a lot of small microcolonies that coalesce, which creates a layer of dental plaque, which is a type of biofilm. Compared to a microcolony, the bacteria in a biofilm communicate with each other via chemical signaling, and together they create a complex system where some bacteria work on tunneling between the microcolonies and to the surface in order to bring in a steady supply of food. As an analogy, if bacteria were ants, then a microcolony would be a tiny group of ants, each doing its own thing, whereas a biofilm would be an ant farm with complex tunnels and rooms, and each ant carrying out a specialized task. So typically dental plaque can form on the surface of teeth, but if the pH of the local environment around the tooth surface remains above about 5.5, enamel will not demineralize. One factor that tips the balance towards caries progression is having less bicarbonate-rich saliva, which can result from conditions like Sjogren's syndrome, radiation treatment for cancer, gastric reflux, or as a side effect of a medication or recreational drugs. A key factor that contributes to tooth demineralization is sugar. Some bacteria ferment sucrose, and that produces lactic acid as a byproduct. In addition, acidic foods and drinks can also cause the pH in the mouth to lower. So a drink that has lots of sugar and lots of acid, like soda, which has a pH of around 3, can damage the teeth in two ways. The bacterial population in the mouth is diverse, and if the pH in the mouth starts to decrease, it alters the balance of power. Bacteria that thrive in a low pH, like mutant Streptococcus and Lactobacillus, start to dominate. As dental plaque grows thicker, the amount of oxygen near the enamel surface starts to fall. That makes the environment on the enamel surface favorable for facultative anaerobic bacteria, which can metabolize sugars with and without oxygen present. If sucrose is metabolized anaerobically, or without oxygen, lactic acid starts to build up, and it can quickly lower the pH on the enamel surface to below 5.5.
The message remains clear. Brush your teeth.